All right, I guess we should go ahead and get started. So, this week, the risk assessment paper is due. Now, what I mentioned, well, I think I mentioned it Monday, can't swear to it. If you need a couple extra days, it's okay if you submit it into next week. Because I want you to have a very polished risk assessment. I just will not put a due date during the week of Thanksgiving. So you've got a little bit of leeway there for that one. The logic models are due the 7th of December, as well as the presentation videos. You're just going to upload those to the discussion area. You are expected to watch every classmate's video and give them feedback on it. Be kind. None of us.
What if I don't have time to watch all of them?
Make time.
Okay.
That also means do not wait till the last minute to upload your presentation because your classmates are busy. So try to get them uploaded no later than the 5th so that everybody then has 2 days to watch them. If you have to finish watching them over the weekend, it's okay. The videos should not be that long. And then, so let's see what I told y'all for the instructions. Right. I did not give you a specific time limit, but you've only got 6 slides, not counting your references. The references that you use as part of your presentation, you should have on a reference slide. You may or may not include all of the ones that are actually in your paper. It depends on what you do for your presentation. Your video should be no more than 10 minutes. Most of your videos are probably going to be between 5 and 8 minutes. If you are doing your presentation and you lose your place or the cat walks in front of the camera, that would happen for me if I was at the house.
Oh, yeah.
Yeah, it's okay. You do not have to start over. Just stop for a couple of seconds, take a breath, and keep going.
Oh, if I cut some pauses, can I make some comedic parts? Like if my cat does walk in front of the camera, if I cut the couple of frames where I'm getting them moved away from the camera.
You can cut that out if you want to. Make sure that anything behind you is G-rated. Make sure that if there's anybody else in the vicinity that they are dressed, all of those kinds of things. Make sure that the background is appropriate. You notice. You notice most of my slides, I don't use decorations for my presentations because it's easier for people to see. Without all of that, it's a little less distracting. You don't have to make your slides fancy, but they do have to be organized. Do not read your slides. We can read your slides. They are supposed to be bullet points. And then you tell us the information we need to know. I'm not expecting them to be perfect. I'm just expecting you to be able to explain what you learned in your risk assessment and be able to explain at least one of the logic models.
So do we have to send the logic models with our presentation, or will they be in our presentation?
They should be. That six slide should have the logic model on it, and you're showing everybody what it is, since they may not be able to read it in the video.
I don't think I'll be able to fit mine on it. Because mine's vertical.
Okay, in that case, you can show a picture of it being vertical and then upload a picture of
I'll
it.
send a photo with my presentation.
Yes, when you upload your presentation into your discussion post, then upload the actual logic model so that people can open it and see it.
Got it. I'm just worried it might be too big for the presentation.
Yeah,
Because it's longer than it is wide.
yeah, that's reasonable. Just make sure you put them together so that we're not all trying to squint, trying to read it.
I zoomed out and it's this tall and
Yeah.
it's thin.
Yeah,
That's not gonna fit on a presentation.
yeah, so just upload it so that everybody can see it. You
Unless I make an animation where it slowly slides up. I'll think about it.
Y'all aren't expected, I need to make sure everybody that's watching this later, y'all aren't expected to do animations. Remember, he does graphic design, so he knows how to do a lot of this stuff. So, yeah, you don't have to have stuff jumping in and out of your presentation, just a simple presentation so that we can learn about your topic. You are now the expert on whatever that topic is you're teaching about.
I mean, if all else fails, I can just make several slides and add a morph animation where the shape slowly moves up every.
Um,
Well, that is what I'm gonna do.
You should be able to upload your video directly to Blackboard. Should. If you need help with that, let me know.
Should.
Or if you want to, you can upload it to YouTube or
Blackboard's been being weird for the past couple of weeks.
there's a couple of other hosting sites that you can use. Just make sure that you put your privacy settings so that only your classmates can see it. You don't want it open for the whole world. And then as soon as you see that I've graded it, you can delete it off of any hosting website that you put it on. That's fine. Now, WebEx, we don't have WebEx on campus anymore. We did last time we taught this. It's like Teams, which is what we use for class.
I've never heard of WebEx before.
It doesn't matter what platform, you can use Zoom or Teams or whatever. Some people will actually set their phone up, like prop it on a book or something, and record themselves, and then they put the laptop in front of them facing the camera, and then they go through the slides and they're talking about their presentation that way.
Just finished my logic model.
So, yeah, how you present it is gonna be up to you. If you need help with it, you've got to let me know well in advance of when it needs to be uploaded, because, you know, y'all tend to work at odd hours and I might be asleep.
At that point, that's just us.
Let's see. And then your final exam is open. You have 60 minutes to complete it, unless you have accommodations, then things might be a little different. It's due on the 12th because I gotta get grades posted. So pay attention, because it's due on a Friday.
Is it due this Friday or next Friday?
It's due the 12th, so it's due.
That's still a while.
Yeah. This is final, the week of the 8th is final exam week,
Fair enough.
but I give y'all, because it's an online exam, I give y'all till that Friday to turn it in. That way you can plan around your other final exams. So yeah, y'all got plenty of time to do it, so there is no excuse for not turning in your final exam on time. Let's see. I think that's all of the, well, almost all of the housekeeping information. So this is the last, today is the last time we are going to meet for lecture. The week after Thanksgiving, we will not have a class meeting. I have to go back to Georgia again. My mother has to have a pacemaker implanted, so I've got to go help take care of them. I'm still more than happy to schedule a virtual meeting with you to help you with something. You can still send me a text, email, whatever you need help with. It's just that we will not be meeting in person after today, because I've got to go deal with that. But that's also, use those 2 hours that, or 2.5 hours we'd normally be meeting, use it wisely. I think that's everything for that. Now, today's lecture, we are going to finish talking about.
I just realized with my pulmonary embolism thing, couldn't a blood clot be big enough to cut off airflow entirely?
Yeah, blood clots can be enormous. My husband's an embalmer. He's pulled blood clots out of people and they're disgusting. Okay. So, remember, I mentioned this last class, but we are barely scratching the surface of research designs. These are the ones that you're most likely to either hear about in your research classes, read about, or in your research classes or internship or some other class, you may actually do some of these. The most common one for community/public health students would be a cross-sectional study that I talked about last class, where you're just surveying a community, a group of people, and you're just hoping they will answer your survey questions. Some of these other ones you might do in some of your research classes or when you get out in your internships. So this one is a pre-post test. The circle with all the dots in it, that is your research population, your research community, your target population. Observation 1, that can be a survey, it can be you watching them do something, it can be, if it's a medical study, it might be lab work or some other type of medical testing. And then you've got your intervention. So if you're looking at your logic models, the activities column, those are your interventions. Use those terms interchangeably. Are you having a letter writing campaign to change people's attitudes about something the school board wants to do? That is an intervention, it's an activity. Then observation 2 is the exact same thing as you did for observation 1. The only thing that you might change is the present past tense of the verbs in any survey questions. Otherwise, everything else has to be the same. Otherwise, you cannot compare them. This is very similar. If you have a class, particularly in college, I don't know if they do this in K-12 anymore. But sometimes a professor might give you the final exam the first week of classes. And you essentially get credit for completing the exam. The professor wants to know what it is you already know about the topic that they're going to be teaching. And then they give you the exact same exam as the final exam. And they are comparing how well you learned or retained information during the semester. And in that case, the course is the intervention. I've only done that a couple of times. Don't usually do that because it stresses students out so much. But sometimes we do need to know, because if everybody already has a pretty good understanding of the material that you would be teaching, you can go a little bit faster or a little bit further in depth than you might be able to when people don't know anything about the topic. In a community setting, in a career, usually people are going to be learning things like maybe stress management, healthy eating habits. Maybe you're offering a cooking class on how to convert a traditional unhealthy recipe to a healthier version. And so you might have the participants answer questions about, what it is they do in their daily life that's related to whatever the intervention is, the activity. And then you ask them the same questions here. For each one of these remaining slides, I'm going to have an example from the literature. So the example for this one is a school enrichment nutrition education program to basically promote healthy behaviors in children. Interrupted time series. So you'll notice some of these articles are very old. And the reason I still have them is because they're such good examples of the type of research. And some types of research are more common than others. This one, I continue using it as an example because it's so easy to understand in the way they've written the article. This is very similar to a pre-post test, but instead of having simply a pre-intervention observation and a post-intervention observation, you've got multiple ones. So the example is a multi-component stair climbing promotional campaign targeting supposed to be caloric expenditure for work sites. And you'll notice it's not from I don't think it's from the US because they're using British spellings and stuff. But think about if you are wanting to promote stair usage over elevator or escalator usage in a work site. What are the times of day that you're most likely to have people using the stairs or something other than the stairs to get between floors? When do you think people will be most likely to use them?
Sorry, I was focused on typing.
So if you wanted to encourage people to use the stairs to get to their floor at work, instead of using the elevator, what times of day are people most likely to use the stairs or an elevator?
Well, it depends on when a lot of people arrive.
Okay, when people arrive to work and when they leave work. Maybe at lunch, depending on the setup of their.
Statistically, elevators move a lot slower than a staircase or an escalator would, simply because there can only be so many people inside of one shaft at a time. And because of the speed at which an elevator moves,
Yep.
you could move up the stairs faster than that thing could reach the top floor.
And that's one way you can encourage people to use the stairs.
But there is one issue that I can see.
What?
Stairs take more effort.
Mm-hmm.
And people don't want to
And we don't
spend
spend the
effort
effort.
if they don't.
Exactly.
If the elevator is there and it's convenient, they will take it over the stairs. But if the elevator is being used too often and it's not as convenient, they will most likely opt for stairs.
They
But
might.
this is also an issue because the elevator is needed for people that physically cannot go up the stairs.
Right.
So people morally choose the stairs.
Mhm.
over the elevator,
Mhm.
because the elevator is exclusive to those who need it.
Right,
And that could be a good reason to use it for. You can label the elevator as necessary for the disabled or the unable to climb upstairs, specifically for that reason.
so you just described an intervention. Putting up something, beside the elevator that encourages people, if you're able-bodied, use the stairs, reserve the elevator for individuals who are unable to use the stairs.
Or if one else fails, you can put in an escalator.
You can, yeah, an escalator
Which
is kind of,
technically just taking an elevator and a staircase and going.
yep, combining them, and so unless somebody is using equipment, mobility equipment that cannot safely be used on an
You can
escalator.
also have those very specific escalators that have really wide steps
Mhm.
for people that can't walk upstairs that well, or people that are in wheelchairs.
So those are different types of intervention.
Those special lifts that people need for, wheelchairs.
Mhm. So in this case, when you're doing your data collection, you would definitely want to observe people and using elevator versus escalator when there are shift changes, when people arrive to work, when they leave work, and probably some other time during the day.
If all else fails, you can put in a slope.
Hmm.
To avoid that struggle of having to pick up crutches over stairs or having to push or pull your wheelchair with you.
So,
Because I don't want to imagine somebody in a wheelchair having to lock their legs onto the chair and go all the way up the stairs.
so when you are collecting that data, it's important to take in consideration time of day. If you've got a building where people work shifts, so maybe you have a 7 to 11 shift or an 11 to 7, what is it? So 11 to 7, these odd shifts where you got 24-hour coverage. You might have to do observations during each one of those shift changes. And then you would also do kind of an off-peak observation so that you can do some assessment around whether people are more likely to do this, use the stairs because the elevator's taking so long. And it helps you better understand that relationship. But you would, after you do your intervention, whether it's putting up signs to encourage people to use the stairs or offering some other type of incentive for people to use the stairs instead of the elevator or escalator. After you've done that intervention, you then have to go back at the same time as your pre-intervention data collection to see if it made a difference. There's another example, I don't have the reference here anymore, I got rid of it, about a research study they did in a multi-story mall. And it was used in time series. So they sent some student researchers to just sit. Fortunately, this mall had the elevator and the stairwell together, so people could make that choice right there. And the student researchers, they just sat there and observed people. And they marked the characteristics of individuals who use the stairs versus the elevator. Now, this was the student researchers' perception of the individuals. They were not actually talking to the people. So there could be some bias there, especially if you're trying to figure out age and those types of things. And then what they did is they put up some signs that encourage people to use the stairs. They went students back to collect data again. And then they did a second intervention where they put messages that you would read as you are walking up the stairs. They would put them on the risers. So if you're walking upstairs, that flat part of the stair that's facing you, that's called a riser. And so they put motivational words on the riser to encourage people to go up the stairs. And they sent the students back again to do the observation, to see if that changed people's behavior. I don't remember the results of that one. I think that putting the messages on the risers did change people's behavior more than just the signs. I can't swear to it. It's been a while since I read it. But it was a multiple interrupted time series because they had another intervention over past the number 6, and then another series of 3 observations where they collected data.
They get something to Craig, that doesn't want to.
So a multiple group post-test. So in this case, we're only doing an observation after the intervention. We are making the assumption, so if you think about your logic model, one of the boxes you have to fill out is about assumptions that you're making. In this example of a research study, you are making the assumption that your 3 groups, your control group and your 2 experimental groups, have the same level of knowledge, attitude, behavior, skills as each other. One group you're not going to do anything with. You're just going to observe them or collect survey data, something. And then you've got 2 other interventions. It could be, well, the example talks about an evaluation of a wildlife education exhibit. So you could do one intervention where there's actually a park ranger that's teaching the youth. And you could have another intervention that is self-led. So maybe the youth scan a QR code with their phone, and then there's an automated video or something that walks them through the exhibit.
I'm not gonna be able to get the logic model on this PowerPoint, it's just too big.
And then you see which one both the youth enjoy more and which one taught them the most. How much did they retain from the 2 different types of interventions? Now, we also have this term randomization. And usually you would have a little R. Let's see if it's going to let me. You have an R right there where you randomly assign participants into one of these groups. The randomization theoretically should result in the knowledge about that wildlife exhibit, whatever it is you're teaching them, should be fairly consistently distributed across all 3 groups. But if you think about field trips, school field trips, it's hard to randomize a group of kids on a school field trip because they all have to stay together for safety reasons. You could randomize the group as a whole to one of these, but if one school is maybe closer to the wildlife exhibit facility, those children may actually have a better understanding.
Tactic. Give every give every child a different piece of paper with a task on it. And they have to do that at least once or twice within their field trip.
That can be an intervention.
It can also be randomization.
Uh,
But you don't,
that won't randomize them.
you can randomize a bunch of sheets of paper and hand one to each student.
Not for, so you can randomize what you're talking about, but that's not the same randomization as research randomization.
I don't follow.
So in research randomization, you are assigning people to one of these groups. So as people come in the door, you're randomly sending them to one of the three groups. But when you're talking about children on a school field trip, you cannot, ethically, you're not able to randomize individual children. Because they all have to stay together because they're on a field trip together and their teachers have to keep them together for safety. So you're not able to send one group over here that do not get any kind of education and another child over here that goes off with a park ranger and another one who scans a QR code. You can't do that with them.
I do have an idea.
But
Would different chaperones be a good idea?
you still can't randomize them because a chaperone is assigned to the children, a group of children, 3 or 4 kids. And so you still have that group of 3 or 4 children that cannot be randomized.
Or why?
Because for safety reasons, the kids cannot be sent out without their chaperone. And if you've got 4 children to 1 chaperone, all 4 of those children have to stay with that chaperone.
But if you give each one of them different chaperones, those chaperones can do different things.
You would have to have a chaperone for every child. School systems do not do that.
You can't just have 3 different groups of children.
That's not randomization because they're
How?
grouped. Because they're grouped.
My brain doesn't want to work today.
That's okay. Remember,
I don't know how that's not randomization.
you can randomize the group of children, but you can't randomize the individual child who's on a field trip.
You can't just give each child a slip of paper on it with a task and tell them to do that.
But that's not randomization.
How?
You're not randomizing them into a group.
That's.
They have to stay with their chaperone.
Then they stay with their chaperone and they just do that one random thing on the field trip.
Not for this type of, for this research study, that will not work.
I don't.
That's okay. It's okay.
To me, then in my head, that would be random. How?
So you've got,
Tell me how.
I don't know if I have a,
Because I'm so confused.
I have a. Oh, alright, so you've got, hold on, I'll have to draw it on the computer, so. See, let's open up PowerPoint. Alright, let me draw. Let's see.
I'm sorry, but it just does not make any logical sense to me.
Alright, so you've got child one. Stop this thingy. Let's see. Annotate. Clear this. Okay, so you've got all these kids in a class. And they only have 3 chaperones. So each one of these kids goes with this chaperone. And then these three go over with this chaperone. Right? You can randomly send a chaperone to a group, to your control group or one of your intervention group. And they would each take their three kids that are assigned to them with them. But you cannot send each one of these children to a separate group because they have to stay with their chaperone.
That is weird.
Because they're not allowed, they have to stay with their chaperone. We'll revisit this one in a few minutes because there's one that, well, it might blow your mind.
I just don't get how that's not considered randomization.
It is randomization here at the chaperone level. It is not randomization at the child
So
level.
to randomize it at the child level, you have to do something different with every single student,
Right. Does that make a little more sense?
I guess.
Okay. It's okay. So
So
this,
I can't just have different tasks on sheets of paper and have them randomly given to a single student.
because they have to stay with their chaperone.
But how's that not considered randomization?
Because if your interventions require that one individual not get any exposure to your interventions, the other group, they're going to be following and listening to a park ranger. And the third group, they're listening to something on their phone. If you got all three of the kids together, they're all getting the same thing.
So if so what if I just have, instead of doing something different with every single student, can I just do something different to one of them?
No, because they're all three together.
I don't get this.
They have to stay with their chaperone.
Can I do something different to every, okay, hold on. Here's an idea. We do this, but every single student in each group is told something different.
Each group, so you can
Every single
randomize
student
the
in each
group.
Is told something different.
You can, yeah, each group can be in a different intervention as long as they're with their chaperone. But the individual students are not randomized.
But, okay, you don't, let me say it this way, every single student is told something different to change their view of this person. That's not what?
You can't do that because you've got those three children with their chaperone.
Move on, I'm so,
Okay, it's okay. All right, we'll go back to this one. Why is this not?
I'll figure it
There.
out later, I don't. Too tired for this.
So
That's my
multiple,
excuse, I'm too tired.
okay. So multiple group, pre-test, post-test. This is a similar example. You've only got two groups in this case, and they're getting two different interventions. This is the type of study that I told you all about last class when I worked on the pregnancy prevention study. So one group of teenagers were randomized into the pregnancy prevention study. The other group of students were randomized into a safer driving research study. They each had the same amount of time that they had to spend in the intervention activities.
Okay, so you randomize them into different groups.
Okay.
You don't randomly do something different to each one of them.
Right.
Okay. So the students were randomized into 3 different chaperone groups.
You can randomize the students into that chaperone group we were talking about.
Okay, so that's.
But those students, when they participate in the intervention, are not randomized.
No, I get it. I think I get what randomization is.
Okay,
It took me a minute.
you're thinking on just a different level, and
It's
it's,
not total randomization.
right.
Never mind, go ahead.
So this is just another example, and the nice thing about this type of study is this group that's participating in, say, the teen pregnancy prevention study acts as a control for the students or the teenagers who are taking part in the safe driving intervention. And then vice versa. So you can actually get for your grant dollars, because usually when you do these types of research studies, you've got grant money. If you're doing it for your job, you get more bang for your buck with the grant dollars because you're actually testing two different interventions instead of just looking at this one intervention. Okay, so this is what I was telling you we were going to talk about in a second. Because in this case, this is what's called a hierarchical or nested design. And this is typically what you can look at in schools. I mean, you can still in other settings, but school systems, because most college students have gone through some type of school system, unless they were homeschooled, and that's a different environment. You are assigned to go to a specific elementary school based on where you live. Families choose to live in certain areas for specific reasons. Some families live or move to a specific school district because they want their child to go to a specific school, or they avoid living in a community where they do not want their child to go to that school. Once you've got children going to a school system, you can compare students within a single classroom. They're getting the same type of education because they're getting it from the same individual at the same time. So you can compare how well they learn the information from that specific teacher. You cannot compare, it's not appropriate to compare a student from classroom A with an individual student from classroom B because they are getting their information from different interventions, from different teachers. You can compare a whole classroom A with classroom B, but not individual students. One teacher might teach English first and then math. Another teacher may teach science and then English and then math. The order in which the lessons are taught, the way that they are taught, can change the way students learn. So you cannot compare individual students from different classrooms, but you can compare, does this teaching style result in higher grades on standardized testing? So does spending all day learning English work better than 2 hours every day on English, which the other teacher might do? Same thing for schools. You cannot compare an individual student or even an individual classroom from school 1 to school 2. because they have different policies within that school. So maybe you have cousins or half siblings that go to a different school than you. Your experiences and what you learned are going to be different. My husband and I went to K-12 in the same county, but we went to different school buildings for most of our K-12 education. And there were books that he had to read and books that I had to read. They were not always the same. And it would impact what we remember. Some of those books I've never read. And then at the school district, so you can compare one county against another county as a whole, but not the individual students. It's not appropriate because the intervention is different. Even if you, so the DARE program, now the DARE program has its own issues, not very good. They have made a lot of changes to it, but since I was a kid, but it's still not that great. But DARE programs are very common across the US. How they are implemented in an individual school is going to vary. It's going to be different from how it's implemented in another school. So the students' experience with it will be different. So you have to make sure that you're doing your analysis at the correct level. If your analysis is at the classroom level, you can compare this student with this student. It is not appropriate to compare this individual student with this student over here. The classroom policies are going to be different. The school policies will be different, and the school system policies will be different. That will impact how well those two children experience the DARE program. You can compare this classroom as a whole with this classroom as a whole. Or you can compare this school as a whole with this school as a whole. But you've got to make sure that you're comparing at the correct level. And so this is an example of a research study that had this nested design. So I don't expect you to be able to, I used to make students do this. I used to make students draw out these and explain them as part of their exam. You don't have to do that anymore. Okay. What you do need to know is the definitions as they're listed in your required readings and in the key terms list. So you're going to have multiple choice questions where you need to tell me, you know, I'll give you a scenario. You're going to tell me what kind of research study this is portraying. But I don't expect you to be able to draw this out and explain it to me. You will see these if you take a research class. Well, you may not see this one, but you're going to see these all the way up through the rest of these that I've talked about. You're going to see these in additional courses as you go through school. And then when you get into grad school, you'll see them again. And in some cases, you're going to be comparing a health-related intervention because you're computer science, your intervention might focus on what software or programming language is the easiest to teach for a specific population. So the design of the research study is going to be the same. Your intervention is going to be related to your career. But you're gonna see these again, and I mentioned this earlier this semester. This presentation, the research study presentation, I would give students this lecture in this class. I recognize students may find it confusing, but what I would see 2 years from now, when students would take the research class for me, I would use these exact same slides the first day of classes, and students got it. They understood, and in one case, I had a student jump up out of a seat, run up to the screen, and start teaching the class. All he got was this lecture that I gave in this class. He was totally confused. I remember the student, very confused. But I introduced him to these concepts, knowing that they're just kind of rumbling around in your head. Over the 2 years, taking more classes and just this information starting to find its home in your brain. When you take your research class, it's going to make a lot more sense. So it's okay if you find this confusing. It will get better. I promise you, it will get better. Any questions about this?
No.
You want to hash through the randomization again? Or are you like, oh, hell no?
I'm good.
Okay. All right, I'll stick around in case people have questions. Otherwise, y'all are free for the day. And like I said, I'm still available to meet with y'all virtually after Thanksgiving. I just won't be on campus because I gotta be in Georgia.